Would you like to get rid of your hip pain quickly? Yes or yes? This video is designed to help you do just that. Plus, you can learn how to get your first 2 treatments in our office for free with your paid $57 new patient exam. Welcome to Concord Chiropractic. I'm Dr. Moon, and this is my assistant, Debbie. For this first exercise, I'm going to have Debbie put her one leg across the other leg. That's good. And then she's going to grab her knee and pull this knee towards her chest. And this stretches that hip, and it's a really good stretch for this hip area. I'm going to have her switch legs and do the other side. And pull it way up towards your chest. Awesome. And you need to do both sides, even if one hip's the only one that's giving you trouble. All right. This next exercise, you can do this on a bed, or if you don't have a massage table handy. And what I'm going to have Debbie do is, she's on the edge of the table, or the edge of the bed. I'm going to have her slide this leg off the side and let it just dangle, because I want to stretch this front part of the hip. Then we're going to pull this knee up towards the chest again and get a really nice stretch. And you always want to do both sides, even if it's just one hip that hurts. So you'd want to turn around and do the other side, but we're not going to do that today. This next exercise is an extension exercise. It's very good for disc problems, and it's also good for the hips. So I'm going to have, you're laying on your stomach, and again, this can be done on a bed if you don't want to get onto the floor. And then I'm going to have Debbie push up, sort of like a push-up, except leaving the hips on the table, and it's going to stretch this part of the back in an extension. And then go back down again, and up again, and down again. Okay, and you can do this about 5 or 6 times. Another thing that you can do while you're in this position is to scoot over towards the edge and drop the outside leg off the side, and again do the push-up, pushing up and stretching. And again, you want to do both legs. Not at the same time, of course, but do it with one leg off and then the other leg off. Awesome. For this next exercise, I'm going to have Debbie on her knees, and then she's going to bring one knee out in front of her. Great. And then what we're going to be doing is stretching this hip in the back. She's going to lean forward and stretch this hip out. And of course, again, we're going to do both sides, but we want to really get a good stretch on that hip. Awesome. All right, for this exercise, we're going to use a weight, an ankle weight. You can do it without the ankle weight, but what we're going to be doing is stretching the hip down. And so I'm going to fasten this on Debbie's hip. You can, there'll be a link down below where you can order these on Amazon, and you can, I like this one because you can choose how much weight you're going to have. It's got 5 pounds on each side, and you can take them out 1 pound at a time. So it can go 5 pounds to 1 pound. Okay, so we've got the weight on. I'm going to have Debbie put her, she's on a stair. You can do this on a stair. You can do it on a book. You can do it on anything where your leg can hang. So just go ahead and let your leg dangle. And so the weight's pulling on the hip and the leg. And then I'm going to have her move her leg in little circles. And then make the circles bigger. Awesome. And go ahead and try the other direction. Great. And again, we want to do this on both sides. Go ahead and stop for a second, Debbie. I'm going to have you move your leg out to the side as far as you can, and back in, up in front of you as far as you can, and back of you. Great. Okay. Go ahead and make little circles. And bigger circles. Hip and sciatic pain is often caused by structural misalignment that causes extra stress on the joints and makes them wear out faster. These exercises will help you between treatments, but you need chiropractic care to fix the structure and stop degeneration from making your condition worse. Have an awesome day.